in talking about necrosis, we said that necrosis results in inflammation, whereas apoptosis does not result in inflammation. So now we're going to talk about the inflammatory response and see why that's a bad thing. Well, it's not necessarily a bad thing. Like a lot of the responses in the body, so cell changes can be a good thing, or they can be a bad thing. Inflammation can be good or bad. Inflammation is a response to attacks on our body or any changes in the body. So, same learning objectives. So, we're going to talk about the inflammatory response, inflammation versus chronic inflammation, and the signs and symptoms and complications of inflammation. I put 40 minutes there. I don't think it's going to take 40 minutes. I try to divide things up into smaller chunks to make them more digestible. But our body has defense systems, and there are multiple layers of defense system. And the primary purpose of all of our body's defense systems are to protect cells from further injury. With inflammation, that's a response to injury, it's protecting from further injury. Also, our defense systems remove damaged cells and debris, and inflammation is the start of the healing process. So, in order to heal from an injury, we have to have inflammation first. Some of our body defenses are non-specific, so this response is the same regardless of the cause, and some of them are specific. So the immune system, the immune response, is pathogen specific. So it's going to have a different response depending on what the pathogen is. So we have several different barriers. There are signs of inflammation. Several different barriers and mechanisms to keep our cells from sustaining injury. So our skin and our other epithelial tissues are our first line of defense. So lots of pathogens or insults don't even get in because if we have intact skin and mucous membranes. So yay. So the fluids like mucus, sweat, and tears also help, and saliva has enzymes in it, also help wash away some pathogens, and they contain some cells that can kill pathogens before they enter the body. There's some neutrophils and macrophages hanging around in there to kind of eat stuff as it comes in, phagocytize things. The chemical part of protection in the saliva, there's some lysozymes and things that are going to dissolve pathogens before they even enter the body. Once it does get in, if it comes in through the digestive tract, the stomach acids are a chemical barrier as well. If the injurious agent gets in and starts causing damage, the body's initial response to any assault of any sort is inflammation. So basically, the body has only limited responses that it can do. And the one response it can do, it can like open up the capillary bed, send fluid. Let's get rid of this pathogen. So no matter what if it's a pathogen or mechanical trauma or all those different types of cell trauma that we talked about, inflammation is the first non-specific response. And sometimes the body can just cause inflammation because it's not sure what's going on, and that's its one thing it do. Oh, something's going on, send fluid. Because if it sends fluid, it can also send macrophages and other white blood cells. It can send immune system cells. The fluid is the super highway of the body. And so if it sends fluid to the damaged area, a lot of times the damaged cells are sending out chemical signals that are promoting the inflammation response, which is pretty exciting. I think. It's kind of nice. There's a nice little question answer thing in the book that you can answer. So when the body initiates an inflammatory response, how do we know? Well, here's how we know. These are the 5 cardinal signs of inflammation. So redness, heat, swelling or edema, pain, and loss of function. There's a Latin term because somebody defined this a long time ago when people were still speaking Latin. The And they all have a cause. So redness is caused by increased blood flow. So if you have increased blood flow, you have increased erythrocytes, red blood cells, and it makes the area look red. So if I go and stub my toe on the coffee table, I'm going to get some increased blood flow. I'm going to get some vascular changes. The increased blood flow is going to cause redness and heat. And the vascular changes are our capillary beds. Normally, all of them aren't open. Some of them are closed off, and we have little precapillary sphincters that are controlled by the sympathetic nervous system. And when you get an inflammatory response, those open so you can get more fluid into the area. So that increased blood flow has some place to go with those open capillary beds. But more fluid in the area causes swelling, it causes edema and fluid accumulation. And the capillaries dilate a little bit and the cells become a little bit farther apart. So macrophages and other white blood cells can get out into the damaged tissue, get out of the capillaries. So that's kind of nice that that happens. But swelling can kind of cause an additional problem, which is pain. And pain can be caused from swelling causes additional pressure on the nerves. That's the mechanical nerve stimulation. And then the cells sending out chemical signals can also be irritating to the nerve. So that's the chemical nerve stimulation. So the pain that's associated with inflammation can also be can be caused by the other part of the response. Loss of function is usually caused by cell death, swelling, and pain. So some of these five cardinal signs cause the next sign, you know. So redness and heat, um, swelling is caused by fluid accumulation, those vascular changes. The swelling causes pain. The cell chemicals that are sent out cause pain. The pain and the swelling can cause loss of function. You can get additional cell death. And usually the chemical messengers that are sent out are from the cells dying gasp, you know. When cells die, they send out chemical messengers like send fluid, save the other cells. It's too late for me, you know. You know, the PTA memory tip is red hot, swollen, painful, and loses function. That's what you're going to remember. Um, so that's all of the signs are have their individual causes. So redness and heat are caused by that vasodilation and the blood vessels widening. So those capillary beds opening up and widening, and you get increased blood flow to the injured area to bring those cells. If you get more blood cells, you get more redness. You get increased cellular metabolism, you get more heat. The swelling or edema is caused by that increased vascular permeability. The fluid leaks from the blood vessels into tissues, and it has to because that's how the white blood cells and the other things are going to get into the damaged tissues. And the endothelial cell retraction creates gaps in the capillary beds, and that's what causes the edema. The pain is caused by chemical and mechanical irritation of nerve endings, chemical irritation from the inflammatory chemicals released by dying and damaged cells, and mechanical pressure from the fluid, and the release of inflammatory mediators. So once the cells start sending out chemical signals, other cells respond. That's how cells communicate, with chemical signals. And you can also get pain from tissue damage and ischemia, which is lack of oxygen to the damaged tissues, because if you damage things, then the normal pathways don't work and you can't get oxygen to the tissues. Loss of function can be caused directly by cell death and damage, but it can also be a protective mechanism. So like protective splinting, like, oh, don't stand on that foot, the toe is swollen. Physical limitation from swelling or pain inhibiting movement. So our bodies are just really good at responding to things. So when it says like, oh, that hurts, don't do it. We have pain is a very strong motivator, either to do something or not to do something. So acute inflammation is inflammation that occurs in a short time period. The signs and symptoms are often quite pronounced, and healing occurs quickly, often with very few residual effects. So the physical therapy interventions for acute inflammation, we call it PRICE, protection, rest, ice, compression, and elevation. Sometimes you hear RICE, rest, ice, compression, and elevation, but protection is important too. We want to protect the damaged area. During an acute stage of inflammation, most exercises are contraindicated. I'm not going to like start standing on my toe after I stubbed it and it's swollen and red and painful. Um, we want to focus on protection and symptom management. So, symptom management, think about that. And then as we go forward and start talking about other treatments in other classes, what are we doing? Are we doing symptom management? Are we trying to return to function? What's going on here? For chronic inflammation, the duration of the inflammation is longer, but the signs and symptoms are usually less noticeable. So with acute inflammation, it's like, yow, that really hurts. All the signs are like really noticeable. Sometimes chronic inflammation is caused by unresolved acute inflammation. So it can also you might not have any acute inflammation. It can come on by itself by like processes going on in the background that are quietly damaging cells can result in chronic inflammation without even having an acute phase. Um, Chronic inflammation is more likely to cause scarring and impaired function. So, if someone is experiencing chronic inflammation, most PT interventions are appropriate, and exercise is typically beneficial for chronic inflammation. So, we want to focus on functional activities and conditioning, sort of, if you can think of it like work hardening, you're kind of letting the tissues regain their natural resilience, if you want to think of it that way. The clinical reality is that chronic and acute inflammation can both exist simultaneously, and they often do. So a good example that's from the book is in with rheumatoid arthritis, which is an autoimmune disorder that affects the cell, or not the cells, the joints. It's a chronic inflammatory condition. So you have a low level of inflammation going on at all times, but you also have these acute flares or exacerbations where it gets worse for a certain amount of time. So the challenge for us is we need to be able to recognize those acute flares and modify the treatment accordingly. So always assess the current inflammatory status before treatment. Are you having a worse day? And so, of a lot of autoimmune inflammatory disorders, you will have these chronic underlying and acute flares. That is a common pattern that we'll see. So you need to know how that person is doing today. And so what do we need to modify, or do we need to modify? Are they having a good day? Maybe we don't need to modify. So there are a lot of factors that can complicate inflammation. There are patient factors, things inherent to the person, and then lifestyle factors, like smoking and alcohol use, promote inflammation. Patient factors, poor nutritional status. If you're not getting adequate nutrition, your cells are not happy. Interestingly enough, lower socioeconomic status often complicates inflammation. And there have been a lot of studies done on this over the years, and there's so many variables in it. It's really hard to tell exactly what about lower socioeconomic status is compromising, complicating inflammation, but it does. Comorbidities like diabetes or autoimmune disorders or circulatory disorders or respiratory disorders can complicate inflammation. If you're very young or very old, a lot of things are worse if you're very young or very old. Genetics, some people they're just inflammatory. Their genes just want to inflame them up. And you can't always say with genetics, it's what you're dealt, but how you deal with it is your lifestyle factors. So smoking and alcohol use are pro-inflammatory. Poor diet and lack of exercise are pro-inflammatory. Particularly if you eat a diet that's high in simple carbohydrates, that's very inflammatory. We'll talk next quarter a little bit about nutrition when we're talking about the digestive system, and it's pretty interesting. If you're not getting enough sleep, that is pro-inflammatory. If you have high stress levels, that is pro-inflammatory. And again, sometimes the external stressors are you can't control them, just like your genetics, you can't control them, but how you react to them. So I always say it's the difference between what you're dealt and how you deal with it. So how you deal with things can affect your stress levels. And we are going to, in many classes, talk about maintaining managing your stress levels because you're in school and most of you are working full time. You have high stress levels. You just do. And so, how are you going to manage those stress levels? How are you going to keep things within their boundaries? And we'll talk about different strategies for that.